Hi, my name's Leah Giarratano. I'm the author and presenter of a training program called Treating Complex Trauma for Mental Health Clinicians. This is a brief overview of the training program. A little bit about my background. I've been a clinical psychologist since 1995, specialising in the assessment and treatment of trauma-related conditions. I've trained thousands of mental health clinicians across Australia and New Zealand in the treatment of traumatic stress disorders, and I'm the author of 7 psychological texts and 7 novels. If you're interested in more information about this training program or about my background, please see talamanbooks.com, and you'll also find more information there about a 2-day training program on treating PTSD. The program offers treatment strategies drawn from a range of eclectic treatments who are showing promise and publishing outcomes for clients with complex PTSD, including attachment-based treatments, schema therapy, emotion-focused therapy, mentalization-based treatments, ACT, CBT, and a little bit on DBT as well. A little bit about day 3 and 4 now. We cover the introduction to what complex PTSD is and how it differs from clients who present with PTSD. We'll also look at other concepts related to complex PTSD, including things like attachment disorders and borderline personality disorders and how they differ and how they overlap. We have a brief section on assessing complex PTSD in the workshop, as well as an overview of the treatment approach, particularly focused on phase-based treatment for complex PTSD. There are some psychoeducation strategies and a big focus on emotional regulation, how to help clients who feel emotionally dysregulated and have great difficulty controlling their emotions, particularly anger towards themselves and towards others. Emotion regulation isn't just equal to arousal reduction. Emotion regulation is a function of attachment that we develop when we're very young children, when we have a caregiver that we're attached to who's acutely interested in our internal state of mind and is constantly asking us how we are and what's going on for us, even before we're verbal. And that eventually becomes internalized and becomes a mechanism for metacognitive awareness, or thinking about what's going on inside my thoughts and my feelings, and also for self-soothing. We'll also be looking at managing the therapeutic relationship. These are clients who very often see you as the best therapist that they've ever seen. And then you'll do something and often you don't even realize what you've done, and it wounds the client and they feel like you're just like everybody else. So we'll be talking about managing that relationship throughout the program, and then also how the therapeutic relationship is a major agent of change for complex PTSD clients. And we'll also be looking at problem behaviours and establishing safety for these clients. Complex PTSD clients are often not safe. They will return to the offender frequently. They might be self-harming. They might be taking a lot of drugs or alcohol or making suicide attempts. So we'll be looking at that, and also managing transgenerational trauma, because there's evidence that we need to protect the next generation of people as well. In day 4, we learn about treating attachment pathology in the here and now for our clients. So helping to heal the attachment wounds in our adolescent and adult clients. We also look at how to foster metacognitive capacity, which underpins emotion regulation. So that ability to think about our thinking, to stand back and look at what's going on inside. So there are a variety of different metacognitive tools that can help clients to do that when they didn't learn that when they were going through the attachment period. We'll be looking at relationship skills and how to facilitate collaboration between our complex clients and the people that they care about. They often did not learn those verbal and non-verbal communication skills that underpin emotional relationships. And we will also be looking at a phase 2 of treatment for complex PTSD, and that involves processing traumatic memories. In day 1 to 2 of this trauma training series, where we learn treating PTSD, we learn prolonged exposure therapy, which is how to process traumatic memories using probably the most widely used tool for trauma memory processing. In days 3 and 4, treating complex PTSD, we don't learn how to do prolonged exposure all over again, but we learn how to modify it for people who haven't got 1 or 2 traumatic memories to process, but they might have 50 or 100 different traumatic memories to process. So we learn how to modify prolonged exposure for complex trauma. We also learn 2 other types of processing for people with complex PTSD, a schema-based technique, rescripting, and also we learn imaginal confrontation, which is an emotional focused therapy technique. And there is also a section on self-care. The trauma training series, days 1 to 2 and days 3 to 4, are available in face-to-face workshop format. They're also available online, where there's a training package that's delivered over a 3-month period where you can work at your own pace, working through exercises, cases, and quizzes. And there are also several live streams throughout the year that you can sign up for and have the opportunity to attend virtually live and to ask questions throughout. For more information about these options, see talamanbooks.com. And thank you for your attention. I look forward to seeing you at a training workshop one day.